Welcome to Pharma. Please don't forget to subscribe to my channel and make sure you like and share this video with your friends. Glucagon-like peptide analogs or GLP analogs are an anti-diabetic medications that are also used in obesity to help in weight loss. Liraglutide and semaglutide are the only GLP analogs approved to be used for weight loss. While Tirzepatide also recently has been approved to be used for weight loss. It has a dual action, GLP and GIP agonist. After ingestion of nutrients, K cells located mainly in the duodenum and jejunum get stimulated and secrete GIP, and L cells that are mainly located in ileum and colon get stimulated and secrete GLP-1. Well, liraglutide, semaglutide, and tirzepatide mimic the action of these hormones. GLP-1 hormone stimulates pancreatic delta cells by binding to GLP receptors, which in turn promotes somatostatin secretion. Then, somatostatin binds to SSTR2 receptors on alpha cells and thereby inhibiting glucagon secretion. GLP-1 and GIP hormones bind to their receptors on pancreatic beta cells and thereby stimulate glucose-dependent insulin secretion and improve beta cells' glucose responsiveness. Semaglutide, liraglutide, and tirzepatide contribute to weight loss by first slowing gastric emptying, and the mechanism by which GLP-1 hormone affect GI motility is not fully understood, but seems to be neurally mediated. Second, by suppressing the appetite by exerting its effect in the brain. Gut-derived GLP-1 hormone may affect the brain by several routes of action, directly by entering the brain via the systemic circulation and by crossing the blood-brain barrier, acting in different areas in the brain that has GLP-1 receptors, including the hypothalamus, or indirectly by activating GLP-1 receptors positive vagal neurons in the GI tract that send impulses and activate GLP-1 producing neurons in the nucleus tractus solitari that project and send impulses to the hypothalamus, in particular to the arcuate nucleus that plays an important role in appetite and energy balance. The R contains two sets of neurons with opposite effect. GLP-1 hormone activate POMC neurons, which in turn inhibit the appetite, and inhibit AGRP neurons and thereby prevent stimulating the appetite. Liraglutide is licensed for weight loss under the brand name Saxenda. Nausea is the most common side effect when first starting Saxenda. Therefore, the dose should be titrated slowly to minimize gastrointestinal side effects. Start the dose at 0.6 mg for 1 week, then increase the dose by 0.6 mg each week, 1.2 mg in the second week, 1.8 mg in the third week, and 2.4 mg in the fourth week. Stay when the dose reaches 3 mg. The treatment should be stopped if weight loss is less than 5% of initial weight after 12 weeks on the maintenance full dose. According to 2016 meta-analysis, liraglutide users lose 5.24 kg more than placebo users over 12 months. Liraglutide users lost 4 to 5% more of their initial body weight compared to placebo. Issues associated with liraglutide include patients are more likely to discontinue treatment due to severe adverse effects. Weight loss tends to plateau after 8 to 9 months, and weight is often regained after cessation. Semaglutide is licensed for weight loss under the brand name Wegovy. Semaglutide is effective for losing weight when used at a dose of 2.4 mg once weekly as an adjunct to lifestyle interventions. The dose should be titrated slowly to minimize the risk of GI side effects. Start the dose at 0.25 mg for 4 weeks, then increase to 0.5 mg for another 4 weeks, and increase over again to 1 mg for 4 weeks, then 1.7 mg for 4 weeks, then increase to 2.4 mg and stay at this maintenance dose. According to 2021 phase 3 clinical trial, participants given 2.4 mg of semaglutide weekly lost an average of 12.4% of their baseline body weight over 68 weeks, compared to those given placebo. Liraglutide and semaglutide do not only have benefits on weight loss and glycemic control, they also reduce the risk of major adverse cardiovascular events in patients with cardiovascular disease and either obesity or overweight. Tirzepatide is licensed for weight loss under the brand name Mounjaro. According to 2022 phase 3 clinical trial, it was found that at week 72, adults with obesity had average weight reduction of 15% with 5 mg weekly dose of tirzepatide, 19.5% with 10 mg weekly dose of tirzepatide, and 20.9% with 15 mg weekly dose of tirzepatide, as compared with a 3.1% weight reduction with placebo. Issues associated with tirzepatide include severe GI adverse reactions, acute pancreatitis, gallbladder disease, and hypoglycemia when used with other hypoglycemic agents. A quick recap. Liraglutide, semaglutide, and tirzepatide should only be prescribed for patients with BMI of equal or more than 30 or BMI of equal or more than 27 with comorbidities like diabetes. Side effects: severe GI adverse effects like nausea, vomiting, diarrhea, constipation, headache, and stomach pain. Injection site reaction, acute pancreatitis, gallbladder disease, and hypoglycemia when used with other hypoglycemic agents.